Prostate cancer. What you need to know. Prostate cancer is the most commonly trusted source diagnosed cancer in males worldwide. In the United States, the American Cancer Society, ACS, estimates that 268,490 trusted source men will be newly diagnosed with this condition in 2022. The prostate is a small gland found in a man's lower abdomen, located under the bladder and surrounding the urethra. The hormone testosterone regulates the prostate. In addition, the prostate gland produces seminal fluid, also known as semen. Semen is the substance containing sperm that exits the urethra during ejaculation. When an abnormal, malignant growth of cells, which is called a tumor, forms in the prostate, it's called prostate cancer. This cancer can spread to other areas of the body. In these cases, because the cancer is made of cells from the prostate, it's still called prostate cancer. Almost all cases of prostate cancer are a type of cancer called adenocarcinoma that grows in the tissue of a gland, such as the prostate gland. However, other rare types of cancer trusted source can also originate in the prostate, including transitional cell carcinomas, such as kidney cancer. Prostate cancer is also categorized by how fast it grows. Aggressive, or fast-growing. Non-aggressive, or slow-growing. With non-aggressive prostate cancer, the tumor grows slowly. However, with aggressive cancer, the tumor can overgrow and spread to other body areas, such as the bones, and becomes a metastatic cancer. There's no known cause for prostate cancer, but risk factors such as family history or age may increase your likelihood of developing the malignancy. Who's at risk? While prostate cancer could occur in any man, certain factors raise your risk for the disease. These risk factors trusted source include older age, 50 years of age or older. A family history of prostate cancer. Certain ethnicities or race, for instance, African American males trusted source are at greater risk of having prostate cancer. Obesity. Genetic changes. Some studies trusted source consider other risk factors like diet and chemical exposure that may increase your diagnosis chances. However, the ACS says those effects are still unclear. Prostate cancer is also rare in men under the age of 40. Some forms of prostate cancer are non-aggressive, so you may not have any symptoms. However, advanced prostate cancer often causes symptoms. If you have any of the following signs or symptoms, don't hesitate to call your doctor. In addition, other conditions can cause some symptoms of prostate cancer, such as benign prostatic hyperplasia, BPH, so you'll need to check with your doctor to get a proper diagnosis. Symptoms trusted source of prostate cancer can include urinary problems, sexual problems, and pain and numbness. Urinary problems. Urinary problems are common because the prostate is located beneath the bladder and surrounds the urethra. Because of this location, if a tumor grows on the prostate, it could press on the bladder or urethra and cause problems. Urinary problems can include frequent need to urinate, a stream that's slower or weaker than normal, bleeding while urinating. Sexual problems. Erectile dysfunction may be a symptom of prostate cancer. Also called impotence, this condition makes you unable to get and keep an erection. Blood in the semen after ejaculation can also be a symptom of prostate cancer. Pain and numbness. You may experience weakness or numbness in the legs and feet. You may also lose control of your bladder and bowel if cancer has spread, causing pressure on your spinal cord. One of the best ways to detect cancer before any symptoms appear is to undergo a screening test. The earlier you find cancer, the easier it may be to treat. Prostate-specific antigen, PSA. PSA is a blood test that measures the number of prostate proteins in your blood. If the level is high, it may indicate prostate cancer. The PSA test is a useful tool for your doctor to consider whether or not your PSA levels may indicate prostate cancer. Since early detection is crucial for treating cancer, this is a major benefit. The test is relatively simple and widely available for people with a prostate that want to be screened. However, there are pros and cons to screening. For example, a 2018 study trusted source found that PSA may increase your chances of early detection, but it doesn't lessen your chances of dying from prostate cancer. The test has some associated concerns, and it is important to discuss with your doctor what the risks of PSA screening would mean for you. Overdiagnosis and overtreatment tendencies. Digital rectal exam, DRE. When you undergo a DRE, the doctor places their lubricated, gloved finger into your rectum to feel any bumps, rigid, or enlarged areas of the prostate. Since prostate cancer often starts at the back of the gland, it may be detected using this method. Although not as effective as a PSA test, it is more effective among men who have an average PSA level but still have prostate cancer. Prostate imaging. Using advanced imaging, such as MRI or ultrasound, you can detect prostate cancer. Prostate biopsy. Sometimes, your doctor may recommend a prostate biopsy if they suspect cancer from an exam or find that you have an elevated PSA level. Non-aggressive. If the cancer is non-aggressive, your doctor may recommend watchful waiting, also called active surveillance. This means you'll delay treatment but have regular checkups with your doctor to monitor cancer. If your doctor chooses to monitor cancer using active surveillance, they check your PSA every 6 months and perform an annual DRE. In addition, they may do a repeat biopsy and imaging in 1 to 3 years after initial diagnosis. The doctor actively monitors your symptoms alone to decide if treatment is needed when simply observing the disease. Aggressive. If your cancer is very aggressive and has metastasized, there's a good chance it has spread to your bones. For bone metastasis, the above treatments may be used, in addition to others. A prostatectomy is a surgical procedure removing part or all of your prostate gland. For example, if you have prostate cancer that hasn't spread outside of the prostate, your doctor may suggest that you have a radical prostatectomy, which removes the entire prostate. There are different types of radical prostatectomies. Some are open, which means you'll have a larger incision in your lower abdomen. Others are laparoscopic, which means you'll have several smaller incisions in your stomach. The outlook is usually good if prostate cancer is diagnosed early and hasn't spread from the original tumor. Early detection and treatment are critical to a positive outcome. If you think you have symptoms of prostate cancer, you should schedule an appointment with your doctor right away. However, if the cancer advances and spreads outside of your prostate, that will affect your outlook. There are certain risk factors trusted source for prostate cancer, such as age and family history, that you can't control. Diet. However, there are others you can manage. For example, quitting smoking could reduce your risk of prostate cancer. Diet and exercise are also essential factors that can influence your risk of prostate cancer. Diet. Certain foods may help reduce your risk of prostate cancer, such as a diet low in dairy and calcium. Some foods that could lower your risk of prostate cancer include fish, oils that contain omega-3 fatty acids, such as olive oil. Exercise. Exercise can likely help reduce your risk of developing advanced prostate cancer and dying of prostate cancer. Exercise can also help you lose weight, and it's vital because 2016 research has shown obesity as a risk factor for prostate cancer. With your doctor's approval, aim for 30 minutes of exercise most days of the week. Prostate cancer is a risk for all men as they age, but if it's caught and treated early, the outlook is generally very good. So as you get older, be sure to have open conversations with your doctor about your risk. If you have any symptoms you think might be prostate cancer, talk to your doctor right away. And even if you don't have symptoms, consider adopting a healthy lifestyle to decrease your risk. A quick note before we end. This video is designed for educational purposes. For personalized health advice, consult your healthcare professional. If you've gained insights from this video, consider sharing it with those you care about. Don't miss out on our future updates by subscribing and clicking the notification bell. Explore more on health and lifestyle with the videos on your screen. Click on any of them to continue your journey. Thank you for watching, and see you in the next video.